As you know, breast cancer is very common. About 200,000 women will be diagnosed with breast cancer in the United States this year, and unfortunately we'll lose about 40,000 women from breast cancer. The thing that makes that even more difficult and more challenging is the fact that it's usually a curable disease, particularly when found at its earliest stage. It can be cured almost 99% of the time. The way to cure it and to find it early is with a mammogram. Now, mammograms aren't perfect. They don't catch all breast cancers, but they catch most of them. There are a lot of things that we've done around the country. Susan G. Komen has done a lot of advocacy to try to help change laws to make sure women can get mammograms and to fund mammograms along with other organizations. There are a lot of women who can't afford mammograms, and so we're trying to make sure mammograms are available for the women who can't afford them. But equally, if not more tragic, is the women who can afford mammograms but don't get them. A lot of statistics show that over 50%, and some say even as high as 70% of women who are insured don't get their mammograms. There's been a little bit of a disservice, maybe not a little, a lot of disservice from some people who have said that women under 50 don't need to get mammograms. And the reality is that about 20% of breast cancer diagnoses are in women under the age of 50. And if you know you're not going to get breast cancer, sure, you don't need a mammogram, but we don't know who's going to not get breast cancer. And so that's why it's so important for every woman over the age of 40 to get a mammogram, not every couple of years, but every single year, so that it'll be in that earliest stage and it'll be curable. In fact, most women diagnosed with breast cancer do not have a family history of breast cancer. 80% of the women diagnosed with breast cancer have nobody in their family who's ever had breast cancer. There is a genetic component, and women who are young who are diagnosed with breast cancer have several family members with breast cancer or have family members with ovarian cancer. A lot of times we'll do genetic testing, and their risk is higher, and those women a lot of times have to be more aggressive with their treatment because their cancer can be more aggressive and they may be more apt to get a second breast cancer. But the take-home message, back to your question, is that most women who are diagnosed with breast cancer don't have a family history. The real statistic is 1 out of 8. So if a woman in the United States is with 7 other women, 1 of them will likely get breast cancer, even if there's no family history among any of them. Family history, a lot depends on how young the youngest person in your family was that had breast cancer. We generally say every woman over 40 needs a mammogram every year. If you have a family member who is diagnosed young, you need to be getting mammograms 10 years younger than that woman was. If she was diagnosed at age 42, then at age 32, that person should start getting yearly mammograms. If she was diagnosed at 35, you're probably going to start getting mammograms at age 25. Genetic testing is important for people who have a very strong family history, particularly somebody in their family under 50 who's had breast cancer, or a male who's had breast cancer, or again, breast and ovarian cancer. We recommend testing those women to see if they carry the gene for breast cancer, even if they don't have breast cancer. But if they do have breast cancer and they have the gene, it means their risk of having a second breast cancer is higher. Their breast cancer may be more aggressive, and they may choose to be more aggressive in treatment to try to prevent that from coming back again. A couple other things that can be helpful when one's diagnosed with breast cancer is, again, remember, this is about the patient. This is about you. This isn't about your sister, your brother, your husband, or even your doctor. It's about the patient who's diagnosed with breast cancer. And our job is to do anything we can to help you. And so a couple of things that I try to use as caveats is include the fact that when people want to do things for you, I think that's great, but sometimes they can overwhelm you with love. Sometimes you need more people to love on you, and work with your doctors to try to work with that. There are organizations that can be helpful. Susan G. Komen for the Cure is one of them that we mentioned too, and they have a website that you can go to. There's an organization called caringbridge.org, and a lot of people found it very helpful to set up a website at caringbridge.org. You can go there and click on it and set up a website very easily, and you can let people know the information that you want them to know. There's a lot of misinformation. A woman might be diagnosed with breast cancer and everybody thinks she's going to die, and that's usually not the case. She can let that information be known that she's not dying, that here are the treatments, here's what she's doing right now. There's some things that just are practical. I generally recommend that you find somebody who's really a really strong, supportive person who can run a country. Most women have a friend who can run a country. And find that person and make that person the one who's going to help you manage your life. There are a lot of things that need to be taken care of in life, and a lot of women tend to deny themselves so that they can take care of their job and their family and everybody else. This is a time when the woman needs to take care of herself. and it's good if she can find somebody else who can help her take care of her life. I generally recommend that you change the answer on your cell phone and your telephone at home, and let them know that I've got stuff going on. I'm not going to be able to return my calls, but if you want to call Susan down the street, her number's 555-1212. She can tell you what we need. She'll help coordinate that, and just thank you very much and hope you understand that we can't return all our calls. And that hopefully people will be all okay with that, and then you can let your Susan down the street know the things that that you want people to know about. And if people want to bring meals, that's great. But if you're allergic to chicken or whatever, she can tell. If you just don't like chicken, she can say, don't bring chicken. And the other thing is, when people bring food, it doesn't mean they have a free pass to come in and talk. A lot of times, the people who are recovering from surgery or in chemo or anything like that don't feel like entertaining folks, but they kind of feel obligated because they brought the food. That's not necessary. It's okay to say, no, thank you for the food. The doctor said no visitors. Now, if you want visitors, well, okay. But most people need a little bit of time to recover and not have to worry about, is the house set up, is your makeup on right, or what's going on. So I generally recommend that we try to limit that as much as possible.